I want to welcome everyone to the last couple of presentations in the course, and thank you all for your hard work. I know we've done and covered a lot of topics this semester, so we're going to end with something that I think is particularly relevant to you all, being in allied health professions, being medical professionals yourself, and it's epidemiology. And I mean, I often think that one of the things we need to do, and I think it's come to light with COVID and RSV and all the other epidemic, endemic, and pandemics that we've had, is we need to understand not only how disease impacts an individual, but we need to understand diseases and spread of disease at the population level. So that's how we're going to end this semester. And you have the CDC links to kind of go through it. So let's begin. I'm just trying to switch slides. That epidemiology is not something that's far away from us. It's something that we live every day. And I mentioned to you that I had worked years ago looking at the instances and the prevalence of asthma for children who live near a bridge that was kind of shedding lead and had a bunch of toxins that it produced. So that can happen. You may hear something about who should receive the flu shot, or the change of the flu shot that it varies by age, but also is quadrivalent, right? Protects against more forms of virus. And natural disasters. So what happens post-natural disasters, and what do people do? And then we may look at, I'm sorry, I'm shut the window. I'm in my office and they're doing construction. But you may want to trace cancer. So one of the jobs that I refused, but I was offered early on in my public health career, was humaning, or being in charge of the database that looked at cancers for first responders post 9/11. And they were forming a database and doing some epidemiological investigation to see how being a first responder during that event affected people's health in terms of cancer and other rare, unusual diseases. So that's to justify that. What is epidemiology? As I mentioned before, it's looking at health not at the individual level, but it's looking at distribution or disease or virus or infection that affect the population and ways to address it. Epidemiology has a Greek origin. So epi meaning upon, demo study of people, like demography, and logos. So we're doing a study of health impact upon population or people. It is the foundation of a lot of public health and scientific inquiry. It is data driven, where you're kind of investigating or tracking a source of disease and then how the disease unfolds in a population or populations. You need to be carefully observing the spread of disease in groups. It integrates a lot of fields, which we often do: biostats, biology, economics, social and behavioral science. And if you ever choose to do a public health degree or focus on public health, you all will know that epi, or epidemiology, is one of the cornerstones of our profession. And it's really neat. I mean, it's epidemiology is both, it's paradoxical that we're trying to find the cause or the vector of disease and how a disease spreads. But at the same time, this disease may be something that has a high mortality rate. So compare the flu to COVID, compare the flu to Ebola, compare the flu to, meningitis or polio, right? That these types of diseases have differing impact on society and people, but we study them the same way, and we have that same curiosity of finding the vector or the way that disease is spread. So the first thing we do, we do many things. We look at the frequency, so how many cases are happening, right? Think about COVID. When COVID as a pandemic was first endemic, how many cases were happening in China? What were the numbers of cases? Where were the location? And we look at the pattern. So how are people, what's the commonality among people who are becoming infected with this disease, right? Do they live in a certain place, work in a certain place? Do they access food or water from a certain place, right? Do they receive healthcare from a certain place? So we kind of look at patterns. And then we want to know the determinants. So this is when I say vector of disease, right? We want to know how that disease is transmitted, and we want to know what are the risk factors. So what are the commonalities among individuals who have or present with this disease, right? We don't think that like Legionnaire's disease from attending an event, or being on an airplane with people who have a particular infectious agent, it's not chance, right? That there's some commonality in the way that people are becoming infected. So we look for that quite a bit. I always think of it like I love mysteries. So I think of epidemiology as somebody doing like a CSI, or doing like a crime scene investigation, or doing a study that's looking at the root and the spread of disease. We want to know where this is happening, right? Is it a particular setting, as I said, a hospital, a community? Is it, when we looked early on when I worked with HIV, is it a community or population? So who's coming in with this disease? Who's presenting with symptoms? And we want to look for the vector. The vector is the source kind of the illness and how that disease is spread. So we often trace back, there are 20 people who came to our clinic who all have this rare set of symptoms, and we find out that they were all at a VFW, a Veterans of Foreign War post, and they were all having it was a party, and they all were eating the same food, right? So we're kind of tracing back to where the possible exposure could have happened. Perhaps the exposure was an air vent, perhaps the exposure was food, perhaps the exposure was something else. Like we want to go back and figure that out. And it's descriptive and analytic, right? So, you're trying to understand something while you're analyzing it. So, what's the pattern of this disease? What else do I need to know? We have to understand local conditions, that, what is going on, right? We have to understand, are people taking a particular medicine for something? Is there a particular, maybe a river or lake or something that people might go to that might have problems, right? We have to be really mindful and understand the local community and conditions where people live. This is the history. And remember, we're going to go to John Snow particularly, but there's a long history of tracing disease, and we'll walk through it. So Hippocrates, right, that remember, we're going back to our early understanding of humors, and that disease was caused by air, water, or places. So, Hippocrates was developing early germ theory about how disease is caused. And then John Grant looked at really collected data, right? Think about how we use, vital records in health departments today: birth, death, disease. We have to track diseases, mortality, morbidity, to see rates, right? How do we know the rate of, of infection in a hospital, community acquired infection, or, other infections, if we don't track the rates? So tracking rates and doing that. And then William Farr, people, tip their hat and say he's the father of vital statistics, but, we need to look at birth records for infant mortality, maternal mortality. We look at death records. We look at other, we report inffectious disease like TB, HIV, those things are reported, and we track them. STIs are tracked, so we can have a sense of both the incidence, right, new cases, and prevalence of those diseases in society. And then John Snow is often in epidemiology, the case that we often bring out, but he looked to see where's cholera coming from. So people are getting cholera in London, but what is the source of it, and how are we finding this disease? And he found out it was from a tainted well. So I love this map because it's visual. He plotted all the cases of cholera, right? Descriptively plotted, and wanted to see where the clusters, right? So it was this infamous Pump A that was on Broad Street, where when people obtained water from that well or water pump, they were getting cholera. So tracing the origin of disease, right here, by looking at people's proximity to that case, to the case. And cholera did things like track rates, right? Get the population census, get the number of deaths, and look at the number of cholera deaths by where people live, by what company supplied the water. So descriptively plotting the cases, and then also going through and figuring out statistically using data where these cases clustered, right? Tested the water, supported the hypothesis that people in these specific regions with access to this water were being infected more. And we do now, I mean, epidemiology has so many flavors, right? We could look at chronic diseases, environmental epidemiology, infectious disease, injury prevention, biomedical, pharmaceutical, and psychiatric, right? Stress and mental health, prevalence, incidence of mental health related to where people live or where people work or particular cases. And what we do is we look to do surveillance. So epidemiology always looks at rates of cases because we want to see if there's a spike. We do field investigation, analysis, evaluation, and linkage. And we also need to make policy. If we find that, think about the relationship of COVID and PPE, personal protective equipment, that the CDC monitors rates of COVID and will, rank it, right? High, medium, low, and then that's related to the level of PPE use. Again, first task of public health and epidemiology is surveillance, right? We need to know what's going on. So you as clinicians and providers are reporting instances of cases and the health department is tracking it, right? We need to track. There needs to be field investigations. Sometimes we just don't have enough information as to why, there's an outbreak of STIs or why E. coli is prevalent in this meat factory, or we don't know. So we have to go and actually go in the field and find more. And then we need to step back and put on that researcher hat and do the analysis. So what is going on, right? Are there other groups in that area that aren't infected, right? We have to really kind of analyze our findings more mathematically or statistically. And then we evaluate. So bring it all together. So is there a program that we can implement in the field that might help what's going on? What is the efficacy, right? That it's not effectiveness, but it's this idea that if we do an intervention program and we put it out there, is it really going to work, right? So we do a couple types of evaluation. It can be formative, focus on plans. We can do focus on process. Did our plans work? Did the operation or the process that we had, was that effective in implementing a change? And then what was the impact of our intervention overall with the health event? And, right, everything in life often is a team sport, but epidemiology takes everyone, right? Think of your hospital. If you have an outbreak, when I worked in a hospital, we had an outbreak of a particular virus in the neonatal intensive care, the NICU, and we had to do many things as a team. So we had to investigate what the source of this outbreak was, right? For this, think of like meningitis, but it was a similar outbreak. We had to figure out how we're going to clean the area, how we're going to move the infants, how we're going to bring families to see their children, how are we going to, understand what's going on, right? So everybody had to kind of work together. And these partnerships, depending on the level of the event, can be global. And then ideally, you want to put policy in place, right? That epidemiologists are really fortunate that they have all these data at their fingertips and they can do recommendations. So the end result of epidemiology, it should be helping the population and clearing up whatever issues are happening, but you can also advocate on a broader level and make sure that this event doesn't happen on a larger scale, right? The analytical approach, think of this, we count. The simplest form, when you don't know the total population, you can do a count, right? You want to show that the rate of disease that you're seeing is higher than what would be normally expected. You often want to divide counts by a denominator and calculate a rate. A rate is easier because rates are more comparable across population. Counts really don't matter. So if I say we have 10 cases and you say you have 10 cases, but my population is 10 and your population is 1,000,000, you know, my rate is much higher. It's 100%. Your rate is much lower. So we tend to do rates rather than counts, but sometimes we do counts because we don't have the denominator or total number of cases. You need to define a case. So who is a case? A case, you know, for somebody who has TB is somebody who tests positive on a TB screen, you know, a person who tests positive, a person, you know, a case of COVID is it somebody who tests positive for one of the simple tests, or is it somebody who tests positive on a PCR, which is the actual presence of the virus, not just the body's reaction to it, right? What defines a case, right? Is it a real case, right? Meaning confirmed? Is it a probable case, somebody who supports symptoms, or suspected? So you need to define who is a case of this illness. And then you decide if you want to be sensitive or strict. So sensitive is like, you know, somebody who could possibly be a case. A strict case is somebody who has a positive test for the disease, right? Suspected or confirmed. Again, we talked about counts and rates, right? And this number is changing with COVID all the time since I've made these slides, but counts are great, but we need to really look at rates. Rates are the gold standard. So we need to know the number of cases per 100 or per 1,000 or 10,000 or 100,000, because looking at 13 million may seem like a lot or a little, but when you look at this is like, it's right, if we round down or up, it could be a third, right? We see that this instance or this rate is a bit higher. So I just want you to think, if you were exploring a disease or the origin of a disease that you see kind of as a quote unquote outbreak or endemic, and we'll talk about endemic, epidemic and pandemic, and those are the ways that disease kind of roll up or expand. But how would you assess it? What would you do? You know, you are all health professionals, right? So you may wear an epidemiologist hat and not realize it, but think about how you would find that vector, find the cause of disease, look at rates, observe where the disease is coming from, observe patterns of disease, and then explain that and use that to advocate at your hospital or your health department to make changes to prevent the spread of this disease. So I'll stop here and then I'll make one more video for our course for this semester.